My name is Tyler. I'm going to be your nurse today. Before we get started, would you let me know your name and date of birth?
It's Caitlin Miller, 10/19/02.
All right, Miss Miller. So thank you, and we're going to let you know that today we're going to be conducting a cardiovascular assessment today. So I'm going to be listening to your heart sounds and then palpating around just to feel for any abnormalities in any of your arteries, and I'm going to be listening to your blood pressure. Okay?
Okay.
So I'm going to perform some hand hygiene, and then we'll get started. All right, Ms. Miller, now that I performed my hand hygiene and put on my gloves, I am just going to be assessing your general appearance before we begin our cardiovascular assessment. So just looking around, I can notice that skin looks healthy and pink, no distress or pain. She looks nice and relaxed. So those are all good signs. So we will go ahead and move on, and I will be checking your blood pressure, okay?
Okay.
Okay, very good, Miss Miller. The blood pressure looks excellent. I got 126/82, so that's a very healthy blood pressure for you. So now that the blood pressure's done, we will move on to our next step. Okay, Miss Miller, so the next part of our assessment is I will be palpating your temporal and carotid arteries, okay? So I'm just gonna be feeling for any abnormalities in your pulse quality and amplitude. So what I'm gonna be doing is I'm gonna place my fingers right in front of your earlobes, and I'm just gonna feel for your pulses for a good about 5 seconds, okay?
Okay.
So just go ahead and just relax, and I'm just gonna feel, okay? Okay, very good. Temporal quality for amplitude is about a 2+, which is very normal. So the next one I'm gonna feel is your carotid arteries, okay? So I'm gonna do one at a time, and I'm just gonna feel, okay? Just go ahead and just relax. Okay, good. I'm gonna do the other side. Very good. So I also felt 2+ on the amplitude on those as well. So we will go ahead and move on. So the next thing I'm going to do is I'm going to auscultate, which is just listening to your carotid arteries one at a time. And I'm just going to hear for any abnormalities, okay? So I'm going to go ahead and get my stethoscope. And I'm going to use the bell of my stethoscope to go ahead and listen, okay? So what I'm going to have you do is I'm going to tell you to take in a deep breath, hold it, and I'm going to listen. And then I'll tell you to let it out, okay? And then we'll do the other side.
Okay.
Ready? Just go ahead and just go take a deep breath in. Okay, let it out. Good. And we're gonna do the other side, okay? Go ahead and take a deep breath in. And let it out. Good. Okay, so I didn't hear anything abnormal in your carotid arteries, no bruits, nothing abnormal, so that's good. All right, Ms. Miller, the next step in our cardiovascular assessment will be, I will be assessing your jugular vein, just to feel if there's any pulsation or any abnormalities there as well. So with this, I'm just gonna have you just sit up nice and tall, and can you turn your head towards that wall for me? Okay, good. I'm just gonna feel. Good, very good. Go ahead and stay turned like that. And I'm gonna go ahead and just use my light here. I'm just gonna assess. Okay, good. So I was just assessing for tangential lightning, which would be an abnormality, which there's none, which is good. So I'm gonna go ahead and do this side now. So go ahead and just, again, turn away from me. I'm just gonna feel. Pulsation feels nice and normal. I'd say 2+ quality on both sides. Okay, and I'm also going to use my pen light. Okay, go ahead. Good. No tangential lighting on that side, so everything looks great. I think we can go ahead and move on, okay?
Okay.
All right, Ms. Miller, so the next part of our assessment is I'm just gonna be assessing your skin for turgor and skin integrity. So I'm just gonna probably pinch your forearm just to see if your skin goes back to normal or if it stays in the shape I pinch at, okay? So I'm gonna do one at a time, so go ahead and just relax. Good, skin went back to normal. Good, turn your hand. Good. Good, everything looks good there. And then we're gonna do the other side. Okay, good, and then go ahead. All right, excellent. So I'm going to go ahead and also assess your capillary beds, again, just to make sure they're having good cap refill. So I'm going to do this hand first. No pain when I do that? No numbness or anything? No tingling? Okay. Other side. Thank you. Okay, very good. Skin integrity looks very good. Skin's clean, dry, intact. Also, it's nice and healthy pink color. And your cap refill was also brisk, less than 3 seconds on each hand, so also indicating good perfusion. So everything looks good up there, and no tinting was observed on the skin turgor test. So that's excellent. So we'll go ahead and move on to our next assessment.
Okay.
All right, Ms. Miller, so the next part of our assessment will be, I will just be palpating your radial and brachial arteries just to feel for rate, rhythm, and amplitude, okay? So what I'll do is I'm gonna go ahead and just feel each one here. So go ahead and just relax and just sit right there. Okay, very good. So feel the rate feels nice and normal, evenly paced. I was actually counting in my head while we did that, so I got a rate of 78, which is perfectly normal. We like to see between 60 and 90. Amplitude, I would say you're a 2+, which is perfectly normal. Nothing abnormal there. Did you feel any pain when I was pressing on your arms at all?
No.
No? Okay. So the next thing I'm gonna do is I'm also gonna feel for your radial, or radial pulse, okay? So go ahead and just relax your arms right here to your sides. Okay, I'm just gonna feel right here, okay? Okay, excellent. So radial pulse, I also felt nice and normal, even on both sides. Amplitude, again, I'd say is 2+, and I was counting those rates as well, and then just multiplying in my head, so I got 80 was the number I got for your radial pulses. And they felt nice and symmetrical, so no pain when I did that as well?
No.
Okay, good. So we will go ahead and move on.
Okay.
We got your socks back on now, so we were just assessing your cap refills on your toes, so those are nice and brisk, so they were returning very quickly, which just means you're getting good circulation down there, which is excellent. So I'm just gonna also feel for your skin integrity and any turgor you may have here. Okay, good. Skin is quick to return. Okay, and I'm also just gonna feel your legs going up here, because we have already inspected your legs and thighs for any superficial veins. No superficial veins were noted or observed. Do you feel any pain or numbness or tingling when I squeeze on your legs? No, good. All right. Okay. Hair distribution is equal. We noticed that during the exam. Okay. Then we also looked at the skin color, which is nice and healthy pink, and you're having good return on your skin turgor, no tinting, no abrasions, no bruising, skin is intact. So everything looks great. We will go ahead and move on, okay?
Okay.
All right, Ms. Miller, so the next part of our assessment is I'm just gonna be palpating your pulses on your lower extremities. That'll include your femoral, your popliteal, your dorsal medialis, and your posterior tibial pulses, okay? So I'm just gonna feel for any abnormality, so you just relax.
Okay.
And I'm just gonna feel, first we're gonna go for femoral, okay? Okay, femoral feels good. And I'm gonna go for right behind your knee for the popliteal. Okay, excellent. So next I'm gonna go and do your posterior tibial pulses, so just go ahead and just relax. Good. And I'm gonna do dorsal medialis. I'm just gonna feel, just go ahead and just relax. Good. Good, excellent. So all of your pulses all the way through felt very normal. Everything was a 2+ amplitude, which is very normal. All right, Ms. Miller, everything looks great. So on that arm, we got a 124/86, and the other arm, we got a 120/82, which is excellent. So we're just using both of these to measure your ankle brachial index at the end of our exam, okay?
Okay.
So the next thing I'm gonna do is I'm gonna go down and I'm going to assess each ankle separately so we can get an accurate reading, okay? All right, very good. So we just got that ankle measured. So I'm gonna go ahead and do the other ankle, okay?
Okay.
Okay, excellent. So that ankle also looks great. So I will go ahead and just use these numbers that we got, and I will assess and give you a number on your ankle brachial index, okay?
Okay.
All right, Ms. Miller, I went ahead and calculated your ankle brachial index, or your ABI. So the normal range is 1.0 to 1.4, and we got you at a 1.1, which is excellent. So that's very good. All right, Ms. Miller, so the next part of our cardiac assessment is I'm just gonna be palpating your chest, anterior chest wall, just to feel if there's any weird pulsations, anything abnormal, any tenderness, any retractions, things like that, okay?
Okay.
So you just go ahead and just sit up nice and tall for me and just breathe right. And I'm just gonna feel around, okay? And do you feel any pain or tenderness when I do this?
No.
Okay, good. Okay, good. So I don't feel anything abnormal. Everything feels nice. Symmetrical, even, so nothing strange, so good. We will go ahead and move on, okay?
Okay.
All right, Ms. Miller, so the next step of our assessment is I'm gonna be palpating your chest just to feel where your apical pulse is, okay? So to find that, we go mid-clavicular line, 5th intercostal space. So I go straight down, right there.
Okay.
Okay, so that is your apical pulse location. All right, so we'll go ahead and move on, and I'm gonna be listening to your heart sounds next. Okay, Ms. Miller, so we're getting near the end of our assessment, so what I still have to do is I'm just gonna listen to your heart sounds. So I'm gonna move into 5 different locations using both sides of my stethoscope, okay?
Okay.
So you can just breathe normal and just sit there nice and relaxed. And I'm gonna move around, okay? So I'm gonna start with your aortic, which is your, right over here. Let's go ahead and breathe. Good. Okay, go ahead and breathe. Good. So now I'm going to do the same thing, but I'm going to use the diaphragm of my stethoscope, okay? So just go ahead and just breathe normal, starting with the aortic. Okay, good. 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 All right, everything sounds very good. S1, S2 sound normal, no S3, no S4, nothing, no gallops, no murmurs, everything sounds good. So the next thing I'm gonna do is I'm just gonna listen to your apical pulse for a full minute just to get a good number on your heart rate, okay?
Okay.
Okay, excellent. So I was just listening to your apical pulse there, which is your main heart rate, just listening for any abnormalities. Rhythm sounds very good, nice, even controlled, good quality beats. When I listened to your apical pulse, I was also counting your heart rhythm and your rate. So I ended up getting 78 beats a minute. So that's perfectly healthy. We like to see 60 to 90. So that's very good. So we will go ahead and move on. All right, Ms. Miller, so we did do an EKG on you and everything looks great. We found normal sinus rhythm on your heart rate, which is perfectly normal. And then we also looked at your rate as well. So we got 78 beats a minute again on your EKG, which is perfect. So everything looks great. That'll complete your cardiac assessment. Is there any questions you have for me at this time?
No, there's not.
Okay, excellent. So I will go ahead and put this in your chart for your provider, and I will let them know, okay?